Hi, my name is Kale Lemons. I'm a student nurse at Wilson State College, and today I'm going to be performing a skill video of dressing change, cleaning the wound, as well as collecting a culture for the wound, and then rebandaging that wound. So the first thing I'm going to do is I'm going to check my provider order. So today I have Shirley Coast, a 54-year-old female with a date of birth of 5/14/1964. Dr. Leo has ordered a dressing of the wound with a wet to damp, changes of the knee are PRN, and then obtain a specimen for wound culture. Okay, so now that I know what I'm doing, I can then head into the patient's room. I cannot perform hand hygiene while I go in. I'll introduce myself to the nurse, or as the nurse of the day, to the patient. So hi Shirley, my name's Kale. I'm gonna be your nurse today. We're gonna be doing a dressing change on your pressure sore on the back. So I just need you to verify your name and date of birth for me. Okay. So Shirley Coast, 54, female, 5/14/1964, and then that matches my Mars with her verbal and her wristband. So I know that I got the right patient here. So now that she understands what we're doing today, excuse me, I can then assist the patient into rolling over so that I can see. So I can assist the patient to roll over. Okay, then I perform hand hygiene once more and put on my gloves. And I can then expose the wound area. And if this were the first dressing change to ever be done, I would just be marking the shadowing because the provider is going to be the first one to do the change and assess it. But since this isn't, I won't need to shadow anything. I'll make note of any shadowing and then I'll be able to remove it. But first I want to set up my area here. So I'm going to open up this with clean gloves on, and I'm just going to prep my area. So here's my biohazard bag. Here's my chalk. I'll just tuck that underneath the patient. I'll get my kidney basin here as well. Okay, so now that this is ready, I can remove the old dressing. And if this tape's having trouble removing, I can use an adhesive remover to help it. I'm just gonna roll it off. Okay, and then place that in there. Get new gloves on, and then just assess the pressure wound. I'd push in and palpate around it for any tenderness. I would know any color, the odor, any slough or eschar that's there. And then once I'm finished with that, I can get on new gloves and get ready to do my irrigation. So here I just have a regular 30 ml syringe, and here I just have regular 0.9 sodium chloride. So I'm just going to open that, drop 30 mils. And then screw on an angiocath tip. And I'll keep at least 1 to 2 inches away from the patient with the tip of the angiocath, and I'll move from left to right from the very top to the bottom so that it runs down evenly. And I'm just constantly cleaning and not dirtying any other areas. and I'll do this as many times as needed until I get a clear return. So it might just be one syringe, it might be 3, but I just want to keep doing it until I have a clear return. There's minimal blood, there's minimal pus. And then once I'm finished with that, I can dispose of this into the biohazard and this into the sharps. That can go in there as well. And now, since I'm done with that, I can get new gloves on. I don't need this or this. And I'm just going to take one of these 4x4s and just dry around the patient's area here. Around the wound, but I'm not going to touch inside the wound, just going to pat to dry and throw those away. And then after I've done that, I can get my culture here and open it up. Okay. And I want to make sure that this one's open and ready. And then I'm just going to pull this one out. And I'm just going to put it right on the granulated red area and push and get force so that I can get return from it. I want to stay away from any eschar or slough. Make sure it's evenly coated, and then when I insert it, make sure not to touch one of the edges and seal it. That can go into the garbage. And then I'm going to put one of these patient stickers onto it. And again, this patient sticker just says Shirley Coles, 54-year-old female, date of birth 5/14/1964, which matches my MAR here. And then with that, I can also label it with my initials and then the date and time of when it was taken. And then put it inside the biohazard bag and seal it up, and then I can designate a CNA to take it to lab, or I can take it to lab once we're finished here. So now that that's done, I can measure the patient's wound. So let's see here, we're going to measure it usually in millimeters or centimeters. So we're going to measure the width, the length, and then so this one's going to be roughly 7 centimeters by 6 centimeters. And then if the wound was tunneling, I would also use one of these cotton tipped wood applicators to go inside the tunnel, mark it with a pen or something, and then bring it out and then measure how far the tunneling is as well. And then so once we're done with that, I can get new gloves on and pour the rest of my sodium chloride in here. I don't need that in there. I'll pour my sodium chloride on the 4x4s. I can remove the kidney basin, and then with one, I'm just going to ball it up and place it right inside the pressure wound, not getting it outside onto the regular skin. Before I do that, I'd make sure to wring it out so it's just damp, it's not soaking wet. And then the same one with this next one. I'd make sure to wring it out so it's just damp, not soaking wet. And then this one's just going to lay over top here. Okay. Just make sure that's ready. And then this is the cover pad here. I'm going to make sure to have the blue line up. Okay. Let me just get a piece of tape out. And then when I tape it, I want to make sure to have at least a ½ inch to a full inch on the skin so that it has a good seal and contact. Okay, and then I'd get new gloves and perform hand hygiene. I would label this with my initials as well as the time and date of when it was done, and then I can roll the patient back over after cleaning out my work area. Discard of this, remove my gloves, perform hand hygiene, assist the patient in rolling back over, making sure they're sitting comfortably, making sure they don't need anything from me, making sure they're comfortable, and then I would leave the room and make sure to clean up my mess before leaving, and then go and document all of my findings, the color of the patient's wound, and how they tolerated the procedure and whatnot.